Bonjour, hello. Just a very quick statement today with respect to the COVID-19 numbers that came out. As you know, we met with the Prime Minister yesterday, myself and the other opposition leaders, to receive the very grim news that has been shared with people across Canada today. That, and I'll just give a quick summary of what that is, which is that if we do nothing different than what we're doing now, we can expect to have up to 20,000 new cases of COVID infection per day. If we continue to increase our contact, which of course is possible given that we are headed into the very cold winter months, given that we are headed into the holiday season, then we can expect at up to and even beyond 60,000 cases per day toward the second half of December. What we have been told very clearly by Dr. Tam today is that what we are doing sets us on a track for more infection and more death, and that our response needs to be more emphatic, it needs to be stronger, it needs to be more coordinated if we are to protect people in Canada and prevent the worst. And I really want to say that again because it's very important that people understand that what we have been doing across our different jurisdictions and at the federal level to date is not enough to protect us from having a major spike in cases and a major spike in deaths. So we need to do something better. We need to do more. Now, the Green Party of Canada had called for an emergency debate to discuss what the next step should be, because we believe, and I do believe that the other parties also support that we should be working together in a cross-partisan way to identify every single tool at our disposal, both federally and also provincially, that can help to bend this curve and to protect lives. And we have not had a discussion about that recently. We believe in the way that we should, and particularly given that we are headed into a dangerous season for COVID. Our emergency request was denied, and we regret that. We respect that decision. But that being said, people in Canada still have the same requests of us. They expect us to be focused on this pandemic. They expect us to put partisan considerations aside to the greatest extent possible, which means all together in the case of our response. And they expect what I believe is clear that we need now, which is a national response to a national emergency. There is a public health component to the COVID pandemic, but there is also a profound social component. There is a profound economic component. And these things make it a national issue and not a provincial issue. This is not a question of jurisdiction. This is a time when a federation comes together because they know that they are stronger if they take a national approach. I stand again with our medical associations, with our health service providers who have said very clearly that they need to see a more coordinated and collaborative approach to the pandemic. And there are some very simple things that we can do. And again, everyone has the modeling. Everyone has seen Dr. Tam's report now. We can identify infection rate thresholds that are national and that would trigger a certain set of measures. We can agree on a national testing and tracing plan. We can agree on national codification. And all of these things can be applied at the local level in a way that reflects the local realities. This is not a question of any level of government imposing their will on another level of government. This is simply a question of doing what is right to protect the most people in Canada, working together in a coordinated, collaborative way on a national crisis. Alors, en français, les nombres sont là, tout le monde a vu les modèles et non, les statistiques sont très inquiétant. Si nous continuons comme nous sommes aujourd'hui, nous aurons à peu près 20 000 cas d'infection pendant la période d'ici le 1er janvier. si nous continuons à augmenter notre contact avec des autres personnes, et ça, c'est tout à fait possible parce que nous sommes en train d'entrer dans la saison des fêtes, dans la saison où nous devons rester à l'intérieur à cause du froid, que c'est possible que nous aurons presque 60 000 cas d'infection et beaucoup plus de morts aussi. Alors, c'est clair que nous avons besoin, et Dr. Tam était très clair sur ce point, que c'est nécessaire absolument de créer une stratégie qui est plus robuste, qui est plus stricte pour éviter des contacts et comme ça pour diminuer les nombres d'infections et les nombres de morts. Le Parti vert avait demandé pour un débat d'urgence dans la Chambre. C'était renié et je le respecte. On comprend qu'il y a beaucoup de choses à discuter dans la Chambre, mais on dit et c'est clair que les Canadiens réclament une discussion et une collaboration entre les partis pour identifier les solutions. Parce que ce que nous sommes en train de faire dans ce moment ne fonctionne pas. Ça ne fonctionne pas et ce n'est pas suffisant. Ce n'est pas une question d'imposer quoi que ce soit sur les autres niveaux de gouvernement. C'est une question de vraiment fonctionner comme une fédération pour attaquer une crise qui est nationale. Ce n'est pas que une crise de santé, c'est aussi une crise pour tous les aspects, tous les domaines de notre société. C'est aussi une crise économique et ça réclame des solutions nationales. Nous avons besoin des messages clairs. Nous avons besoin d'identifier les numéros, les taux d'infection qui déclenchent des restrictions. C'est possible de créer un système de codification. C'est possible d'avoir des messages clairs. C'est possible d'avoir un système national de dépistage. Alors, on demande encore la création d'un groupe intergouvernemental créé des officiels de santé pour créer ces systèmes nationaux, pour créer une approche nationale. And sorry, I didn't say that in English. So I will say we are asking again for the creation of an intergovernmental task force whose job would be as quickly as possible to identify all the areas that would be better served by a national approach and making sure that we have the national approach in place. Because the system now is very confusing. I am confused. You know, for every Canadian out there who feels embarrassed or that they don't understand what they are and are not supposed to do, I am with you because I do not understand most days what I should and shouldn't do. And the comments by the Prime Minister today, which do not align with the comments of some of our provincial premiers in terms of what we should do, how quickly and for how long, continue to reinforce these mixed messages which leave people confused and which leave people understandably opting for what is easiest. And unfortunately, in this situation, what is easiest is not going to be what is safest. Alors, nous avons besoin des messages coordonnés. Ce n'est pas possible de continuer avec un message de nos premiers ministres provinciaux et un autre message de notre premier ministre. Les gens vont choisir et moi, je le comprends très bien parce que moi aussi, je suis fatiguée. Moi aussi, j'aimerais bien voir ma mère. Je n'ai pas vu ma mère. Ça fait presque 8 semaines que je n'étais pas dans la même salle avec ma mère. Mais les gens vont choisir les options le plus simples, les options qui leur donnent le plus de liberté. Alors, si nous demandons aux gens de rester chez eux, de restricter leurs actions, leur vie, il faut être très clair et il faut avoir des messages coordonnés par tous les différents niveaux du gouvernement. Et avec ça, je prends les questions. I'm ready to take questions.
So we'll now take questions, starting with questions on the phone. Reminder that it's one question, one follow-up per reporter. Nous allons maintenant prendre des questions. Commençons par les questions au téléphone. Petit rappel, une question de suivi par journaliste. Operator, do we have a first question?
There are no questions registered at this time. Nous n'avons pas de questions pour le moment.
We'll take questions from the room. David?
Hi, Madam Paul, David Thurton, CBC News. Any pickup from the other parties, even from the Prime Minister, at what you're suggesting, a national task force?
I've heard a lot of pickup from the public, and I think that what it's going to take really is the public demanding what they deserve here, which is a coordinated approach. Absolutely, we need to respect each other's areas of jurisdiction, but there is no question that when you're talking about a national emergency, one that touches every single aspect of life, that we should be coming together to find a national approach wherever that makes sense. And when we hear the Canadian Medical Association, when we hear Dr. Tam acknowledging that individuals cannot solve this alone, that we require a systemic approach and we require a much more robust approach than the one we have, it's clear, again, that we need this joint approach. And so I have not, David, I have not heard any of the other opposition parties joining me, but I do hear, and this is more important to me right now, I do hear more and more of our health providers, our frontline workers, the general public saying that this is just good common sense. If I can't understand what I need to do over the next couple of months to protect my family, and I don't, I will say that I honestly don't. I don't know what I should be doing in Toronto as compared to Ottawa and for how long and with whom. If I am confused, then there are many people out there that are confused. And if we hear different messages from our premiers and then different messages from the Prime Minister about what we need to do, how long we need to do it for, and how important it is, then people are going to opt for what is easy because they are tired. They are tired of living under a pandemic. And so I'm hoping that even though we did not have the emergency debate on the creation of this intergovernmental task force, that we will acknowledge what the medical professionals are telling us, which is that we do need a national coordinated response to this pandemic.
So some of the criticism to this task force isn't just that it might violate provincial territorial jurisdiction, but we heard from the NDP leader before you spoke that this task force might be a bureaucratic lair that could prevent us from acting quickly, and what we need is quick action. And we know what we need to do, according to Mr. Singh, which is to support people so that they can stay home. Do you have any response to what Mr. Singh said?
I will say again that this was very clear from the briefing last night, it's very clear to anyone who was listening to Dr. Tam today and saw her modeling. There are some things that at this point we know enough about so that they can be standardized. The rate of infection or the reproductive rate that should trigger a lockdown or restrictions or the inverse. A national codification system so that we understand everywhere in the country what it means to be in a red zone, in a yellow zone, in a green zone. National testing and tracing, because we know from examples in other jurisdictions, in other countries, that those national approaches to testing and tracing are exactly what is needed. So this is not a bureaucratic exercise. This is about putting the decision-making about the strategies we should take in the hands of the officials, the health professionals, and the scientists that should be driving this process. This is not somewhere where the politicians know best. This is a context where the health officials should be driving the decision making. They have told us that they would benefit from a national coordinated approach, and we can get that done as quickly as possible if we have the will. And I want to stress again that this is not about the federal government imposing anything. What I would like to see is the Prime Minister contacting the other premiers and inviting them to come together, to send their officials, rather, to represent them in this task force as soon as possible, again, in a nonpartisan spirit, recognizing that that is what is needed.
I'll check once more if we have a question on the phone. Operator?
There are no questions registered at this time. Nous n'avons pas de questions pour le moment.
Do you have more questions?
You just said, Madam Paul, that you're confused and you don't know what to do. So what are you basing your decisions on during this pandemic when it comes to safety, the safety of yourself, the safety of your family? are you just do you feel like you're just flying blind?
A lot of the time I do. I try to, my default is to opt for the strictest option. And so I live in Toronto most of the time when I'm not here in Ottawa. And in the case of Toronto, I'm trying to restrict my activities to what is essential, only leaving my house when it is essential. And I don't have children who are in school, in primary or secondary school, and so I don't have that to worry about. But I'm trying to do what Dr. Tam has told us we need to do, which is to restrict our contact as much as possible with anyone who is not outside of our immediate household. But it is really confusing to know because we have some businesses that are open, we have some that are not. The goalposts are changing all the time. We don't see consistency even between the municipal and the provincial levels of government in terms of what they think the threshold should be. And so I can't see why we would not benefit from having national infectious rate thresholds that would trigger various actions that allows different jurisdictions to be in different zones of color, depending on how successfully they've been in tackling the virus. But it means that we understand whether we're in Ottawa or Toronto or in Nova Scotia or in British Columbia, we all understand what it means to be in a red zone or a yellow zone or a green zone. And there are some things which is simply, if they are not done at the national level, if they're not coordinated nationally, they cannot be effective. Testing and tracing is one of those things. This is one country. Our borders between provinces are invisible. And so, and this is why, again, I say that this is a national crisis. If you're able to move freely across most of this country, then there has to be a way to be able to test and to track in a way and trace in a way that allows us to better protect ourselves. The countries who have been most effective in combating the virus and keeping their infectious rates down are the countries who've successfully done testing and tracing.
This is all the time we have. This concludes the press conference. Ici, fin à la conférence de presse. Merci.
Merci beaucoup.